and like, ah, you're too noisy. And like, I said, you don't have to be around me.
Friendship may actually go beyond just relating on a
superficial
basis.
There's the adage that says, show me your friends and I'll tell you who you are.
There are some of us who are not very good at regular visit, but because they are friends,
you have to.
in order to maintain that friendship.
The emotional state of the parents is usually directly proportional to the emotional state of the children.
Hello viewers, welcome again to our favorite family show, The Living Room, right here on Equa TV International. My name is Amaka Ocheke, and today we are still revisiting the issue of raising godly children. And today we have a special guest here with us who will help us navigate raising these children in such a way that they will be healthy. So it's not just that they are godly, but they are healthy, godly children. So right here in the studio with me is Mrs. Namu, Ibe Namu. She's here, and those of you who are not doing what is correct, be ready. She will give us, and then Dr. Ruth Ada is here with us. Ruth is a pediatrician at the Jos University Teaching Hospital, stroke dermatologist. She also does skincare. So she'll be here to tell us more about, or she's here to tell us more about how to raise our children in a healthy way. So Ruth, you're welcome.
Thank you,
and thank you for coming.
Thank you.
All right, we'll just dive
straight
into the matter. Yeah, we've in the last two episodes or so, we've talked about raising godly children, and one of the issues we raised was that we wanted the children, or we believed that children should be raised the way Jesus grew, in stature, in wisdom, favor with God, and favor with men. And stature is physical, you know. And we felt we needed an expert to come talk to us about how we need to raise these children so that they are healthy, godly, and all that. So I know that people say, well, it's the truth that the health of the child starts before the child is born. So speak to that for us.
Yes, you're very right. Of course, we know that right from pregnancy, in fact, it's advocated right from preconception, before the mother becomes pregnant, the mother should be healthy enough to carry a healthy child. So there's this concept we call concept of 1,000 days. So that is from the child's conception to maybe about 2 years. So at that time, that's where the real building blocks for that child's future in stature, physical, in fact, everything, emotional, intelligence, everything is formed at that time. So at that time, when the mother is pregnant, there are some things the mother should do to make the child healthy when the child is born, and then every age has every stage has something you can do. Yeah.
So while the mother is pregnant, okay, even said preconception care. Yes, so okay, before before a woman gets pregnant,
yes,
there are specialized things. Well, it's a specialized field, but there are things that a woman should do before she embarks on pregnancy. So she must be sure she's healthy, blood pressure is okay, blood sugar is okay, any other illness, whatever, is taken care of.
Yeah.
Her blood level should be fine before she embarks on it, so that we're sure that the baby has good environment.
Exactly.
That the baby will, okay. Let's start. The woman and gets pregnant.
All right. So again, that's your field. You know, once the woman gets pregnant, of course, you know, you have to go for your antenatal, their immunizations, nutrition tips, sanitation tips, things to make your baby healthy. So, and all those things, and educational tips, the things they will tell you to do, and teachings that you have to take through that will help you. Like they start teaching you breastfeeding, how to take care of the baby and all that. And it helps even the father comes during that time. So that's another very special period. Usually it's the obstetricians that do that.
Yeah,
one. Yes.
To prepare for that.
Yes.
And then we advocate that women should begin antenatal care once they miss their periods. Worst case scenario, 2 periods. You should, but unfortunately in our environment, people don't come for antenatal care on the average until they are like 5 months gone before they come for antenatal care. Mrs. Namu, I'll ask, why do you think women don't like coming for antenatal care? I have some idea, but tell us from your own experience.
Well, I think that it is our environment, like the place where I stay. I know that some women, it's when they are like 6 or 7 months before they start going for antenatal. And once I have asked a few of them that they don't have money, that these doctors will be touching them anyhow, these doctors, they will be asking for money, and since she's not feeling sick, what is she going for antenatal for? So I think that is a concept that they grew up with, that was passed down from their maybe parents, that it's only weak women that go for antenatal. So when you are going for antenatal, they look at you and say you're not strong, and that's why some of them even attempt to give birth at home. And it's when they start having crisis, they now rush to the hospital. So more of it is because of their upbringing and the environment in which they grew. I think that's some of the reasons why some of this, and the fear of the doctors will ask for too much money and all that. And there are some other people who have religious concepts. They are thinking if they go to who is going to attend to them? As a woman, you don't want a man to touch you, and most of the doctors they think most of the doctors are men.
Well, most of the doctors are men.
Why should they go to the hospital and then be attended to? A man will be touching them anyhow, all of those things, So sometimes it might be their cultural concept, it might be their religious concept, it might be the environment within which they grew.
Okay. Ruth, do you have any addition to that, why women are not coming?
I think after all she said, I think the basic underlying thing is ignorance.
Yeah.
There's a deep ignorance of what the advantages and the benefits of antenatal care. Yeah. So I think everything she said, but I think the underlying thing, whether they believe in myths and what you call touching anyhow, it's actually respectful is
they don't
care.
See it as that. They don't see it as the doctor is not just touching you because he fancies your body or something. He's doing something he's trained to do. They don't see it as that.
And then the sad thing is that for those who decide to book for antenatal care very late, they don't benefit from the advantages and the good side of antenatal care. And for many, if there are problems, they are picked up late.
Yeah.
And the interventions that should have been done before the pregnancy advances will not, and then the child is affected. And unfortunately, so many times you don't see the effect there and then. It's much later. Certain things will be manifesting, and then you forget that you are the cause of the problem. So please, viewers, go for antenatal care. After missing 1 or 2 periods, please go for antenatal care. Doctors touching you, they are not touching you sexually.
Exactly.
Is respectful, and they usually would have a chaperone there. Usually a doctor will not be alone with you in the room.
Exactly.
There are people around, and they touch you respectfully. There are things they are looking for. And let's face it, the doctors see so many patients every day. What's so special about you?
Exactly.
I'm sorry, but we need to say it. What's so special about your body? Body that we see and we're tired. People are even sometimes dodging work because the patients are too much. There's nothing special about your body. There's nothing to, as you step out of the room, we've forgotten what we saw and we move on to the next person. So please, make the best of the antenatal care and come to hospital early enough. It's not weak women that come for antenatal. Sure. It's strong, sensible women who want a good outcome for their babies. And husbands, you are the ones. So it's not, head of family is not to sit at home and be shouting, I'm the head. It's to make sure that people are doing the right things in your house. And that includes your wife going for antenatal care early, giving her the money she needs for transport and to buy food when she goes there.
And medication. And all those things.
So please.
I also want to say that there are times when some people go for antenatal care, but they don't keep to
what they are asked to do.
They are asked to do. I remember a woman was having, I think they said the baby is, the placenta is down and the baby is up.
Okay.
So they asked her to come for surgery because she was due. And her people told her that she was lazy, that's why, that she should be climbing staircase, she should be pounding yam, that is because the baby did not drop, you know, and eventually she started bleeding.
Of course,
and you know, it took intervention of the same doctors to save her life, but she lost the baby. And you know, funny enough, there's a nurse who lived inside her compound. The nurse kept telling her, this thing these people are telling you is wrong. Go for treatment. Go to the hospital. She said no, that she has prayed, and then she's doing that. Her baby, don't actually not worry, her baby will come down, and she lost the baby.
So that's another thing. Please let's listen to what the doctors have to say. The doctor, I don't think doctors benefit anything from telling you to come to hospital for treatment. So let's listen to the doctors. And somebody said something recently, maybe 2 weeks or so. We had a health week in church, and one of the doctors said, look, to be a specialist, he has spent more than 12 years. So he knows about this more than any of you.
True.
So all the people in your compound, your neighbors, your family members, they cannot know more than the doctor.
Exactly.
So whatever they are telling you, they cannot know more than the doctor. And when it also comes to prayer, we all believe that God answers prayers and God does miracles. But remember, when Jesus healed the leper, he told him to go and present himself to the priests for the priest to confirm that he had been healed.
So if said you should put mud on the face.
Yeah. So if God has healed you, even the doctor will attest to the fact that, oh, situation has changed. But not that you refuse to come for us to confirm that situation has changed. And God has prerogative to heal and to help us the way he desires to. You can't determine for God how your own healing and deliverance would come. So please, let's not be stubborn and get into trouble. Anyway, let's get back to the children matter. As a follow-up to that, go for antenatal, deliver with a trained healthcare professional. She had mentioned earlier that some people like to deliver at home, some people like to deliver in their church for various mission. And then the unfortunate thing is, yes, some people get away with it, but there are some people who have problems and they are not referred early. By the time they come, either baby is dead, we are struggling with the mother's life, or sometimes baby is alive. But that baby, Dr. Ada will tell us later, that baby will have long-term problems. Long-term problems. Some we can't even solve. You just be managing yourselves. And some of us decide that it's enemy that is attacking us. Meanwhile, we are the enemy within that have attacked ourselves and our babies. Okay. We've delivered the baby.
Yes.
Dr. Adam, over to you.
Yeah, so I like the way we took it. Remember where the Bible says that children are a heritage of God and that they are like an arrow in a strong man's quiver. Yeah. So with an arrow, if you want to shoot it very far, you know, the Bible describes it as that they will contend with your enemy at the gates. Yes, so they are actually meant to contend. What you couldn't do or what you have not reached, the child will do it.
Do better than you,
either in God's kingdom or anywhere.
I like that. So, if it's young people, they say word.
Word. Yes. So
I like that.
When you want to shoot it far, you have to pull. If it's an arrow, you have to pull back. So
very well.
That pulling back is that preconception pregnancy. You understand? Before you shoot out the child now in the delivery, as she has said. So the child has come out now. So we are releasing the arrow now. As the child comes out, of course, we have talked about deliver in a standard healthcare under supervision of a health worker. When the child comes out, for you to have godly children, the first thing everybody thinks of is that when the child cries, we want that child to have contact with their mother. We call it skin to skin. But I'm not going to emphasize on that now, but that is very important because there are some nice bacteria, we call them symbiotic organisms on our body that are supposed to take their time and now land on the baby, so such that it protects the child from the bad bacteria. So in that holding, there are many things that happen with the mother. The mother is able to lactate and everything. We want the baby to be close. We don't like this one that you put a cradle and everything.
So you don't like Oyibo style?
No, we don't like Oyibo style. All right. So, having done that, the first thing that should enter that child's mouth is breast milk. Breast milk is very important. It has its own natural immunization. In fact, we believe that in those days when there was no immunization, breast milk did everything. Because breast milk is a living organism. All the things the mother has experienced as in terms of like illness, the antibodies is embedded in that breast milk that will protect the child from that. So we want the first thing to be breast milk. And we now want the child to continue an exclusive breastfeeding. Because they found out, and many research has shown, that breastfed babies are healthier. They have healthier weights, not the type of either elephant weight or the one that is underweight. They're not obese, they have very healthy weight. They have very good bone structure. They have very good skin. They have intelligence. They have found that they have higher language and faster language skills than their peers that are not exclusively breastfed. So breastfeeding is very important to us. The Bible says Jacob was blessing Joseph, and he says he wants Joseph to have the blessing of the breast and the womb.
Wow.
We believe that the
I
blessing...
said this girl.
So the blessing of the breast is that breast milk. And we want it to be exclusive. Exclusive means 6 months. We don't want anything, no water, no breast milk
What if the
substitute.
child is thirsty? That's what some people have
Hey,
asked.
thank you for asking me that question.
What if the child is thirsty? How can someone not drink water?
Breast milk has the exact amount that the child needs. It's a lot of fluid. In fact, the way the breast milk comes is that the first one that comes, the fore milk, is a bit watery so that it quenches the child's thirst. Then the next one that comes is full of fat to make the child gain weight and grow well. So those people that even feed just 5 minutes and stop or change to the other one, they're just feeding water. We want you to feed on one breast for at least 10 to 15 minutes, then you move to the next breast so that you have the whole package. It has the whole package. It has water. It doesn't need anything. So exclusive breastfeeding for the first 6 months is key. It will help that child now and in the future.
Mrs. Namu, why are people not breastfeeding their children?
The same thing we have said about antenatal meats, beliefs, and okay, like when I had my first child, I was doing exclusive, and my mom came to visit, and then
Mothers.
in fact when she came, the second day she was to give my baby a bath, and then she was like, why is your container so empty like this? I say, I don't understand. That a woman that just gave birth, you should have bomoro, you should have
Feeding bottle, all those
you
things.
should have all those things that the basket is supposed to be full. I said, because my daughter is not eating anything but breast. She said, hey, that I want to kill my daughter.
That's what my mother
That
said.
what kind of a thing is this? She schooled me and schooled me, but I stood my ground. In fact, she tried to give the child water when I'm not looking. So I caught her twice. So I decided that whenever she's giving the child a bath, I'll come and sit down. So that she'll say, see, your child is crying. I say, give her to me, I'll breastfeed her. So it's because of their orientation, you know. They grew up to know a child, they will give a child, even some of these drugs, you pack a child and put the leg like this and force him or her to drink something that you yourself cannot even take. And from what the doctors have said, these children's body, their inside is still very tender. Some of these chemicals are not too good for the children. So, but they do, and you know, drugs, you know, all of those drugs, you know, you have Abidec, you have cod liver oil, you have all those things that I don't know. And you make your child, and it's just because of upbringing and you know, myths of our old.
So please let's listen to what we're being told, and if the pressure is too much for you, because I know sometimes, a young woman called me one time that she come to her house that her mother-in-law is giving her pressure.
Neck, yes.
She wants her to feed the baby with something else, and the husband was not talking. It's like sometimes men too, when their mothers come powerfully, they can't talk. They keep quiet too, and then she didn't know what to do anymore. So I had to go to the house that day and talk with her mother-in-law to say, no, you don't give this baby, you know, other things. You don't give the baby water. You don't. This is what is best for the baby, and watch and see how the baby will turn out. The baby will turn out very well, and you'll be happy with the baby. I know the pressure can be much, because even me, I was under pressure.
Yes.
My mother was what is this? What is that? I've never heard this kind of thing before. They said, what do you say? Exclusive. She started calling my baby exclusive. Sarcastically, not that she was happy about it, but after the first one, she saw that was what we did, and then they adjusted.
They adjusted, yeah.
Okay, so we've agreed, though, viewers. I hope you're agreeing with us that breast milk for the first 6 months is best for the baby. Okay, the other things we also need to do early: immunization. Ruth, tell us.
All right.
So that we'll not say we didn't hear.
Okay, backtracking to that breast milk, breastfeeding. We need male support, father support is so precious because of what she just said. If the father can step up and say, "This is what I want in the home," it will reduce those pressures on the mother and the choices they make. Now, immunization again. Immunization is just introducing a weakened pathogen or some parts of the pathogen so that the child can build his own immunity. At a certain time, the immunity that the mother gives the child, it gets exhausted. So the child has to start building his own. And we have all of them. From the first day, there are some, and it spans up to sometimes up to 15 months. It depends on the routine that you have per country. In this country, we have, from the first day, we start with BCG and some other things. So we have first day. That first day sometimes it drags up to 2 weeks. We allow around 2 weeks so that we don't want that you have a child, people are coming to visit you, carry to church and everything. The child is already exposed to people that are coughing, so many things, to bacteria, to viruses in the home and everything, and you have not given it that first time. So that first 2 weeks is very important to us. So after that, we have the one that you do at 6 weeks, we have the one that you do at 10 weeks, and then 14 weeks, then 9 months, and then 1 year and 15 months. There are some that are repeated. So immunization is very important. Some women complain that, I remember my son, when I had the DPT, now it's combined. It causes great fever. At that time, it caused great fever. My son, I was carrying him. That night, I was in Zaria with my mom. I took him out because he was hot and he was just making sounds. I thought he was going to die. As a doctor, I was a resident.
It can be scary,
but I said, I cannot give my child immunization again after that. I know how it feels. But these are just transient things. A little paracetamol will take care of it. But it is that important that even new ones are coming. There's a new one now called HPV.
Yes.
Yes. There's another one they are thinking of bringing malaria. And then later in the year, they are trying to introduce enteric fever, which is very good for our children. They are one of those things that they are introducing are the causes of death among our children and future women.
Since you've raised HPV, please let's talk about this HPV now,
yes.
because they're about to launch it here on the plateau
yes.
in 2 months, next month, I think. Yeah.
Yes.
So I should talk.
You should please talk about it. HPV.
Okay, HPV vaccine is a vaccine against the human papilloma virus. Human papilloma virus is the virus responsible for cervical cancer. That's cancer of the mouth of the womb. So it's been found that if young girls are given the vaccine, ages 9 to 14, right? That's the age that they are targeting for this round of immunization. 9 to 14, if we give them that vaccine, the risk of cervical cancer drops. We know there are already a lot of rumors out there about HPV. People are saying it makes people not to get pregnant again, it kills people. But a lot of people have sent me messages asking, HPV is safe.
Very safe.
Like every other vaccine, it's safe. So, well, maybe some people may have some small side effect, maybe pain at the site and all that, but it's not going to kill anybody. It's not going to make anybody to be infertile. So please, once it's rolled out in your area, wherever you may be watching from, please take your daughters 9 to 14 to get the HPV vaccine. It will be beneficial to them. Don't listen to lies that, it's the same way people were talking about polio vaccine. That polio will kill people, polio will make people infertile. Even educated people were saying all that. Meanwhile, polio will be killing and maiming children. Have you seen? I hope viewers, you've seen people that have had polio as children.
Yes.
Is that how people should be? So let's do the best we can to protect our children and keep them away from all these early childhood diseases that will prevent them from growing. And is immunization, is it expensive?
It's free. It's free. It's free.
It's free, at least at government hospitals.
Yes.
It's free. Even in private places, it won't be so expensive. Maybe you
Just
pay for consumables,
needles and all
needles
those things,
here
yeah.
and there, but it's not expensive. So please, let's come out and immunize our children. Make sure your neighbors are immunizing. Make sure your relatives are immunizing their children. You can use look for something to use and threaten them. If they don't immunize, you won't visit them. If you don't immunize, you come for Mugo or whatever, so that people have to go and do immunization. Okay, that's immunization gone. Or you want to add something?
I was thinking we were going to talk about giving the children a bath.
Okay, first bath.
Yes.
Okay,
Okay,
good, tell
well,
us because
That's a very good topic.
Yes, and then
the
the
way they give birth, the children birth is
and then
Yes.
pressing the head.
umbilicus too.
Yes,
and
cord care.
umbilical,
Okay,
yes,
let's
cord
talk about
care,
that.
yeah.
Okay. So when the child is born, we delay the cord cutting a little bit so that the blood can. So when you have the stump, there are two ways that you can take care of the stump. We either use a spirit or a chlorhexidine gel. So it depends. If you have the spirit, they'll tell you do it frequently, 2 to 3 hours, and all that. No other thing should be put.
Exactly.
We see that some of our people
Salt.
will use rag
Salt.
and put it in heat,
Salt.
and
Yes.
start massaging the place.
Salt.
Or
I
I
see
put
some people
salt.
even hot
Put
water.
salt.
they do.
Yes,
hot
you put
water,
on the
that.
salt.
Yes, and then I did a study, and I've gotten some people, they some put toothpaste. You've heard of toothpaste?
Oh,
They've put
Why would you
some,
want to put toothpaste? Is it teeth?
I don't know. So they just put the gel there, and this another combination they did was black soap. Black soap. They
Dudu
just
Oshu.
yes, Dudu Oshu, but the local one and all that. And then we still see it's supposed to be eradicated. We still see neonatal tetanus, and that is the easiest way, because what you're seeing in that cord is arteries, and it's going straight to the body, to the heart. So it's a major vessel in that place. So anything you put there will surely get to the heart. So we still see tetanus up till today. And it
I
kills
think
people.
the one
Kills
of the
children.
things that people have said is that the one that they say you should just be cleaning with spirit, it takes a longer time to fall. So these ones that they put very harsh thing falls on time.
Okay,
What
what's the
are
rush?
they
What's the
rushing?
rush
What are they
making it
rushing for?
fall?
What are they rushing
If it
for?
falls, then what?
Exactly.
So we have a space of two weeks. It's not, we don't bother about the falling. If you come, many people we've seen mothers worried that 7 days, 8 days, we still have to. It's
As long
not
as it's
abnormal.
clean.
Yes,
It's
as
clean.
far as it's clean,
It's clean.
not bleeding, no discharge, and all that. So that's called care.
But even the spirit, you also need to. There's a lot of fake spirits
Okay.
out there.
Yes.
So you need to get good spirit.
From a
How
good
do you
pharmacist.
test?
So actually, it's a desiccant. It's supposed to dry. So you do it by pouring it a little on your arm, and it evaporates quickly. But there are different powers. What we advocate is 70%. It mustn't be 100% methylated spirit. 70%. So the quicker it dries, the more effective for us. So that's what.
Because
we
I've seen
advocate.
some spirits when you pour it,
It will just
2
stay
minutes
there.
is still there like water. It's not evaporating. So you know that spirit is not. And there's a lot of
Yes,
spirit that
yes.
is not good out there.
Yes,
So
yes.
we must test it and be sure that it's good.
Yes. So it's, and then chlorhexidine, they do that. They just put it on the stump and leave it till the next bath, usually once or twice a day.
Okay.
that
So now
one
let's
is
enter that bath.
Okay,
How
so
is
the
supposed
bath,
to bath?
yes. The bath. Now, that first bath, we actually advocate that is delayed. There's nothing special about having, the smaller the baby, or even the more premature the baby, the longer. Sometimes even up to a week or 2 weeks before you touch, or even the first month sometimes.
So will the child have body odor? Because they say
At
babies will
all.
have body odor.
It has nothing to do with that. It
don't
has
give
nothing-
proper
no, it has
Okay,
nothing to
okay,
do with that.
okay.
Then we noticed that bathing a baby, you should not take more than 10 minutes. I've seen they will do it as if they are coming for a village ritual.
That ritual.
They will
It's
put
like almost 1 hour.
The
1 hour.
ritual,
no, because the baby's skin at that time, there are many things. The epidermis is not as thick, and there's a junction is not well connected and everything. So his skin can easily get
You put the child
macerated.
inside water,
Yes,
oh,
yes.
bring it
So
out,
we
oh.
don't advocate bathing of more than 10 minutes, and it's sharp. So within the bathing, the water temperature, we just want it to be between 40 to 50 degrees. Not hot thing like that. You're actually harming the baby. So we don't want
So
that.
that water that some grannies, their
that
hands
is
cannot
steaming.
enter.
no,
The
no,
bottle
no,
is
no,
and
no,
bath.
no, no. That's
Okay.
that's
I
not
hope we're
correct.
hearing.
I'm pressing the
Yes.
baby's head. That you want to shape the baby's head.
And here, that person that comes tells me, because this story I'm telling you is a personal, somebody we know, and the person is a believer, he's a missionary. I was embarrassed. He came to the EP where I was working, and his baby had a fracture. Newborn baby. His mother and him. And the wife was saying she didn't want it. They were doing that bending,
Bending the hand
turning,
back
this
so that the
and
baby
everything.
can be
Fracture.
flexible.
Yes.
So you want
Fracture.
your baby to be a gymnast.
So there was a fracture. I was so embarrassed that a Christian can cause such harm. A very mature Christian. I was so upset. So there's nothing like that. The baby will grow with or without. In fact, we don't even want that. Yes. No, we don't do that. We don't do that. It's wrong.
So
It's
we don't
wrong.
need to be doing
No, we
gymnastics.
shouldn't do that.
with the baby.
We
Do the
shouldn't
hand
do
like
that.
this. Twist, and the
We
baby
do that.
is screaming.
Yes, in pain, causing pain. So no, we don't do that. So then, the more neutral your soap is, the better. There's no. We don't want antiseptic soap. Antiseptic is like, it's like me saying that you're on antibiotic every day. Some people are on antiseptic soap every day. So that soap that you're using, it actually has antibacterial. Every day you're harming. We just talked about having a colony of very good bacteria. It's wrong. So for a child, just use neutral soap. Any of these baby soaps, I don't want to name call brands, but any of the neutral
You
ones.
don't have to break a bank. Because
No,
some
no,
people
no,
are
no,
looking
no,
for
no,
very
no,
expensive
no, no,
soap.
no.
When I had my first child, that's how we're using expensive
expensive
soap.
one.
The baby reacted to everything until we came down to one very simple one
Yes.
that's everywhere.
Yes.
Yeah.
So basically, is there any other thing we've missed
What
about
about
it?
the rashes that normally come
Okay,
out of
good.
babies?
All right,
Yes.
yes.
What do
So,
we do with
so
that?
there are some rash that we don't call them pathological. They're just physiological. I mean, it's part of what is happening, and they don't need treatment. So if you see a heat rash, you know that you've swaddled too much clothes. In fact, I don't know why it's only Nigerian babies. It's only Nigerian babies that they feel that don't need cool air. You know, Nigerian babies, we always think that layer.
Three caps on a baby's head,
And then
especially in Jos.
someone came one day, I was complaining to my husband that the baby doesn't sleep. My husband said, if they wrap you like this, will you sleep? So my husband just started removing some of the clothes. And the baby slept off.
Yeah, yes. So this is the main cause of heat rash. So you see that there's some other things we see, but they are the early ones you see. Usually there's not a problem. It's when the rash is now associated with things like fever, other symptoms. Yes, we should panic and come to the hospital. But those new ones that you see in the first few days or few weeks are usually benign. There's really nothing wrong. It's just transition of the child's skin, and he's getting adapted to the environment.
We're still coming to the skin rash, but we're going on break. It's time for break.
All right.
We'll go on break, and then when we come back, we'll continue this discussion on Dr. Ruth is giving us so much
Yeah,
information.
in
I'm
fact,
so
we
happy.
need it,
Even me,
yeah.
I've learned some things
Yeah,
today.
yeah.
So don't touch that dial. Don't touch that dial. We'll go on break, and when we come back, we'll still talk more about a few more rashes before we move on to the other things.
All right.
Thank you so much for still remaining with us. See you right after the break.
Make your everyday informative, make your everyday count. Know your world, daily affairs, national and international, with authentic news events as they unfold on Global News and Zuma Nigeria, Monday to Friday at 1 p.m.
Hello viewers, my name is Amaka Ocheke. We anchor the program, The Living Room, right here on Equa TV International.
You are welcome to watch us every Monday.
The Living Room is a very interesting family program where we discuss everything you want to know about family.
Talk about our children's mental health.
Keep watching. Our program is always here, 5:30 every Monday. We want you to ask questions. We want you to phone in and drop topics that you want us to talk about, even on our media handle on Facebook. We're there. So keep watching, keep listening. The Living Room. Hello viewers, and welcome back from our break. Thank you for not touching that dial. We've been here at the Living Room of Ekwa Television talking about raising godly children, and we've been today talking about how to physically raise our children. And Dr. Ruth Ada has been here giving us a lot of information, also with Mrs. Ibi Namo. We've been talking about all these things. And my name is Amaka Uchike. Back again, we stopped on skin issues with newborns, and we're back again. Dr. Ruth is going to still tell us a lot. Now, what of all this? What do you call it? Is it what? Eila.
This head.
Ila. Yes.
People
Okay.
complain about
Yes. Okay.
This one that the child has a part.
Yes, I know what you're
some
talking of.
here, this crown.
Yeah.
Okay, so you know, different people and different tribes have a different concept of Ila.
Yeah.
Some people think Ila is diarrhea. They'll say it's inside
Yes.
that is coming out, or some feel it's rashes, some feel it's hair loss, all that. But I think the basic thing that guides what they think Ila is that they have a skin issue, and that's scaly redness, loss of hair. Now, it's actually a condition we call seborrheic dermatitis. Seborrheic dermatitis is there's some, how will I explain inflammation? Inflammation is like your body is getting used to or reacting a little bit to something, yes, to something foreign or something. So the inflammation is there, but it's inflammation against a particular fungi. This fungi is a very friendly fungi. It's supposed to come and colonize our skin. Almost 99% of human beings have that. Colonize, it stays around, we call it seborrheic areas where there are oil glands that are active. And that's the scalp, the face, the neck, the chest, the perineal area. So as the child is born, that fungi colonizes that place, which is good. But the child reacts a little. So she will now start having that scaliness and all that. And people think it's a big illness. It is not. In fact, if it's mild, we do even ignore it. And a lot of the treatment is cosmetic, so that the mother doesn't get worried. I actually am treating it because of the mother. If not, I'll leave it. Because the treatment will need a mild steroid and a little topical, that's the cream, antifungal, and it goes. But because the child is still getting used to that fungal, it will go till maybe a little after infancy. So that's what they call Ila. It's actually seborrheic dermatitis, and it's a very mild.
So parents,
calm down.
Calm down. It's going to get better.
Yes.
Because sometimes when I even tell them, look, this thing is going to get better, you can see on their face like, okay, you say so, but they don't believe you.
Yes.
So it's
What
going to get
about
better.
the separation in the middle of the
Anterior
head?
fontanelle.
That one, that they used to cut.
Yes, and put it. Yes.
Okay.
You've noticed a lot of things. All right. So yes, they have that. That is anterior fontanelle. You're supposed to have the bone, the scalp, the head bones are not supposed to fuse because the brain is growing.
It's growing.
Yes, and that is supposed to be like that for the child to come out, because there has to be some, how will I put it?
The bones
that overlap
each other,
so that they can come out.
Coming out during delivery.
Yes, so it cannot be fused. So the child has to come out with that thing. So that place is open. There's another at the back that is open. The one here is supposed to close at a certain time. The one at the back is supposed to close. It closes earlier. This one, up to maybe 18 months or so, it's supposed to be open.
They don't talk about the back one because it's covered by hair, so they don't
don't
see this
see.
one.
I know a
that they
woman whose
noticed.
child died because of this thing.
No, it's not.
She went to the hospital and I think they gave her advice. I don't know what they told her in the hospital. She was using, then all these people in the house told her that, there is some local medicine that can do it.
So the problem is, it's not a problem. Whether you see it moving, or how do they call it? They say it's breathing.
Yes.
No, that is how your blood vessels and your heart is beating.
Moving,
Yes, it is normal. There's nothing wrong with it, and we use it to know if the pressure in the head is high, because in some diseases like meningitis, the pressure is high, then we see that place bulging. Once we see it's bulging and it is not moving, it's tense, we know the child has a problem. But you know, we have to also tie other symptoms to it, and we'll know. But we'll know whether it's meningitis. But normally, that place is supposed to be there. It's supposed to be breathing normally. You understand? It's supposed to be open to a certain age. To a certain age. So there's nothing wrong. The problem is, you see some people put some paste.
There's some
They
one black
think-
thing.
One
yes,
black something
yes,
they put,
yes,
or they cut wrapper,
yes.
put.
The problem with that paste is a lot of it is traditional.
Yes.
And then remember, we said the skin of a child, things can easily get absorbed. So once you do that with traditional thing and everything, things can absorb straight to the brain.
Wow.
So maybe that was the cause of that woman's issue you were speaking about. So that's another one we have debunked right now.
Yes.
Then,
So-
finish. There's
So
another
which other one again?
Stool. Baby stool.
Yes.
They say, hey, the stool is green. Oh, it's jadi jadi.
It's what-
Jadi,
what
jadi,
you-
jadi, jadi.
And
Oh,
I've asked
it's
people,
strong stool.
I've
The
asked people
brother is eating
what
bread.
is jadi jadi, and different things define jadi
Definitions.
jadi. I don't know. So please speak to this, the color of the baby stool, so that
All right.
people can have their rest.
Okay. So stool, remember stool, what is added to it is bile. It depends on how the bile or how soon it's digested. Bile is usually green. So between green and brown, any scope of that color is normal. Even if it's green, it just shows that bile did not have enough time to turn to brown in the distance. It just rushed out a little bit this thing. Green to brown, any of those shades is normal. The one that we see that is not normal, if the stool is pale, is white, there's a problem. There might be a blockage of something there. If we see it's black, there's a problem. And if we see red things like blood, there's a problem. But any color from green to brown is normal to us.
Okay. Viewers, I hope we're hearing. Okay.
Titi.
We're still in newborns, so we have not moved.
I don't want to
Titi.
No, before you do titi, you have to talk about diarrhea.
Okay.
Diarrhea, because, yes,
diarrhea.
yes.
Yes, diarrhea is one of our highest killers in children. And the diarrhea is usually viral. What causes it is viral. Almost all diarrhea is traced to sanitation and hygiene. Sanitation and hygiene is not what you ate or something. Yeah, a few percentage, some children can react to some food and something, but it's almost insignificant.
Hygiene
Yes.
matters.
Hygiene is the main thing. This hand washing is the thing that we should use to protect it. If you do exclusive breastfeeding, you're free from diarrhea at that time. Of course, except you have other things that you're putting the child's your mouth and everything, like all these feeders and all that, you understand? So that has saved you from that. Mothers should know that in everything, before they breastfeed, before they feed, even if it's cup and spoon, hand washing. You go outside, there are some specific times for hand washing. When the toddler is also moving around and touching everywhere, he should wash his hand, because at that time we allow them to do finger feeding. So it's usually sanitation, hygiene and sanitation that is the cause of diarrhea. And when this diarrhea comes, because we live in Africa, there's organisms everywhere. Sometimes we can't escape it. When it comes, every mother with children, particularly under 5, should always have ORS. There's this ORS that is sold in sachets in their fridge. Just keep it as emergency drug, and you have a container that you can measure. I'm sure every house has it. So that is our first thing to go: ORS and clean water. And I'm sure they teach it in antenatal, they teach it in immunization clinics, and maybe one day you will have a time that we can do demonstration.
Okay,
okay. All right. Yeah. So that's the main thing in diarrhea. If you see, diarrhea is actually the definition. Some people get confused. They just feel once it's loose. No, yes, it's loose. It should be much more than what the child is doing, significantly more. Some people say upwards of more than 3, but it depends on, because a newborn can give stool 8 times is normal in a day. In fact, as he's breastfeeding, his stool is normal in a day.
Waste of Pampers.
That brings me to another topic. Actually, Pampers, we're not supposed to use it more than 2 hours. In poverty Nigeria, can we?
Dr. Rush, we beat you today.
Yeah.
Okay.
So,
viewers, listen.
That's the standard, though, because I don't know, even if I practice that, that's the standard, though. But
okay, so Pampers shouldn't be there for more than 2 hours.
Diapers actually.
So diapers should That means you have to use 12 diapers a day.
Yes,
day.
but you know the
Wow.
sleeping time.
Okay.
You don't count the sleeping time.
Okay.
Yeah,
okay.
so the
about
heat-
6.
Yes, so but what we usually do is that we tell them once it's wet. So even urine, just change it. Yes, that small amount of urine can bring the moisture that yeast, the organisms are looking for, and the water that they are looking for. You supply that urine, that no matter how small, then the heat it's closed will now cause issues. So the standard is about 2 to 3 hours in a day.
So that means ideally, if not that there's a lot of mess, then we do children free to air.
That's
leave
the
their bum
actually
bum
yes,
open,
yes. You
but
leave
it's-
their bum. But once you release it and you want to clean, once you clean it, you leave it for some time. Give them 5 minutes to go without diapers before you put it on for them.
Okay. Oh. We hope. So viewers, I hope
So if you are
we're
using
hearing.
napkin, because some women are using napkin, they will say they cannot afford the diapers. What to do.
So it's about the
shouldn't
same
be
thing.
wet.
It shouldn't be wet. That's the main thing. And then of course, because we've heard now that some people are even doing this disposable one. They have turned it to reusable.
Yes, they will soak it in water, bring it out and dry it.
Not that's the diapers, right?
Yes.
In fact, they don't soak it. Once it's just only urine, they'll just hang it to dry. Let the urine dry up. Then they wear.
My goodness.
But you know, it's the country. It's the country we live in. Normally, you should be able to afford these things.
Yeah.
You understand?
Diapers are so expensive.
Yes.
I'm so happy I'm not having kids again.
I can't.
So that's diapers. Where were we? We were talking of.
She asked about.
Teething.
Okay, no, she's been interested about.
It's
this.
book up to
because there's there are so many myths around the
around
teething
teaching.
thing.
Okay,
Yes.
all right. Okay, so
Maybe we'll
we'll
go
go
with the teaching so that,
I
we'll
can
talk about
have this.
all right. So the teething, maybe from 4, 5, 6 months, you start seeing signs that some children. It's usually around 6 months. So the only thing teething does is that it can be a little bit irritating. You see the child maybe gnawing or trying to bite things and everything. That is all. Teething is not an illness. It doesn't give you fever. It doesn't give anything.
Doesn't give fever and diarrhea.
It doesn't give fever and diarrhea.
So when the child is pooing at 4, 5 months, you hear parents say, it's
No.
teething.
So the problem why they believe that is that at that time the child now is able to touch things. You understand?
And put
He's
some
able
on.
to some children are able to sit. So they are able to touch things. And now because he's teething, he's puts it. So that's where hygiene comes in. Once he does that, maybe he has picked up some things and then the diarrhea. So they now say, okay, because it's this, and they now say it's the teething. But teething is not an illness.
Okay. So if a child is having fever at that age, the child should be brought to hospital.
Of course,
don't
yes,
decide on
yes.
your
Don't
own that
say
it's
yes.
teething.
Don't say
Actually,
yes.
any child with fever should come to hospital. Yes. Don't treat on your own and decide. Whatever
Let me
it is.
raise this issue. There was a time I went for, we went for immunization. Before immunization, they will always do talks.
Health talks.
And after the talks, they will make you see the doctors. It was in Jute, old Jute. You see the doctors, before you will now go and take immunization. So there's a room where, you will sit like a doctor will attend to like 2 of you almost at the same time. So I was sitting with one woman and she was complaining that her child wasn't sleeping at night, the nose is blocked, or she was just complaining, and the doctor was saying, Madam, I will not prescribe any drug for this child. Just take this child home, keep the child warm, and reduce the clothing on the child. So she said, Doctor, it's like you don't understand what I'm saying. I said, this child in the night is breathing like this. She demonstrated the breathing. The doctor still looked at the child and said, I'm not going to give you any drug. Just go and do like this and do like this. So we left. As we were walking away, she was following me behind. She said, what these doctors, all these small doctors, they don't know what they are doing. That she will enter pharmacy and buy drugs.
This is
for
the
her
problem.
child.
This is the problem.
I think we should speak to that. Parents should be careful the way they buy drugs, especially for children.
We come from a culture that if it's not, maybe it's traditional, you must be supplementing something. We don't think the natural things we are doing, the food we eat is enough. If at that age, they're either giving one multivite or so, when you're getting older, say if you're not on so supplements and everything, you must go be mixing one herbal thing and everything. No. I think if you follow these precepts, these small concepts, you don't need anything extra. Like this case you gave, that brings me to emphasize the role. We call that clinic well child clinic. The but we just mix it with immunization. It's good to come for those days because at that point they are monitoring the child's weight and height, how the child is growing, so that even if you don't pick something as a parent, they will pick it from what you're saying. Because once a child is ill, you will see it in the weight, that's acute illness, or if it's long term, you'll see it in how the child is high. So that's another thing. And then all these things like catarrh, actually catarrh is viral. There's no drug for it. It's not an antibiotic. But once somebody has catarrh, the usual thing is that they will want to go and take an antibiotic or something. For children, it backfires for the children usually because it just stops it, but it clogs it, and then there still will be what we call postnatal drip. It will be dripping there still. So you just don't want it to come out. So we don't want that. What we want is that you can do, yes, we want it to even do steam inhalation, let it come out. So when they have this upper respiratory tract infection, we say do steam inhalation, and it's not the traditional steam inhalation we do.
Please describe this.
It's not the one, because we have seen many bonds. We don't carry the child. So what we do, we will, for example, let me take this my mug, beautiful mug, as my baby. Once you want to do steam inhalation, baby is on your lap. The hot water is here. You will feel how hot the water is. It's not like it must be boiling and this, but steam should be able to come out. So you're with your baby sitting here, your water is here on the floor. You understand? That's all. Some people additionally cover, but even if you don't cover and you put the baby, that's okay. Yeah, that's all about stimulation. So you're with the baby. There's no, you don't put the baby like they do over the steam. No, it's wrong. So that's how we advocate that. Recommend.
So water just hot enough for steam
to be coming up, to be rising. Yeah.
Okay. Oh, interesting. I hope we're paying attention to what we're saying. Okay. Now we've done immunization. You've talked about some early childhood illnesses and all that. Okay, maybe we'll just touch feeding before we go.
Okay.
Because it's almost time.
Oh, okay, all right. So we've started with exclusive feeding. So between exclusive and joining family meals, there's something we call complementary feeding. So we call it complementary because, for example, your complementary card, it's a little bit about you. You have your whole CV that has everything, but the complementary says, take this is about me. So that's what that complementary feeding, that's not the main feeding. So from 6 months, your main feeding is still breast milk. 1 year is still breast milk. Up to 2 years. In fact, the ideal is that breastfeeding should be 2 years. WHO says 2 years and beyond.
Wow.
So if we...
You want people to be talking and say, Mama, come and sit down.
That's what we want to. What they were doing in those days was the correct thing. That was the correct thing.
Yeah.
So when the further, the better. In fact, I've seen a Time magazine of one model that breastfed her baby. I wish I forgot. I didn't know we were talking about this. She was very white lady. She breastfed her baby, I think, up to 5 years or 6 years.
Wow.
So the WHO says and beyond, but 2 years good. So breastfeeding, the breast milk is still the main thing. You start adding other things. Of course, some people, because some people are lucky the child eats solid immediately.
Yeah,
but usually
eat solid
immediately.
Yeah.
Usually semi-solid, so that they get their tongue. There's something we call tongue thrust, so that it gets acclimatized and now they will be able to swallow solid food. Now, when you're doing that at that age 6 to about 1 year, your extra food you're giving to your complementary breastfeeding, it should be twice or thrice in a day. You give them, there's a way we feed them, we call it responsive feeding. So you're gradually introducing them to all the diversity of food, and then the amount and the frequency. So as the child goes beyond 1 year, you can give up to 4 times a day before he now stabilizes. Snacks are important to children, even for adults. For adults, we recommend, now, I don't know if we are still doing 3 meals, but now let's... So if we say, for example, 2 meals, we're actually recommended to have 2 snacks. A meal is supposed to be maybe between 350 to 600 calories. That's for an adult or a teenager and above. So each meal is supposed to give you a certain amount of calories. There are 2 things important to children. that the meals are varied. So that's we call minimal meal diversity. So that, because if they are not varied, you won't have all the
food
nutrients.
groups.
Yes. So we advocate that in a day the child takes up to 5 food groups out of the 8, and the groups are things like grains, tubers, vegetables, poultry, milk. He should have a mixture of 5 at least for that. So he has gained his diversity, because when you do that, you won't have anemia. The micronutrients, those small things we don't account for, will be answered in the diversity. Then we have what we call minimum meal frequency. So that's what I was explaining, that for a child between 2 to 3, you should have 2 extra meals apart from breastfeeding. For this age, above that, you should have 3-4 meals and snacks within. There's something we always forget: hydration, water. Very important. In fact, I think somebody should do that study. I noticed that Nigerian parents, I don't know whether it's a school thing, there's a lot of sugary drinks. Yes. Yes, what we call juice, but there's high sugar content. And when there's high sugar content, it forms an osmotic load. Sugar is high, the body tries to dilute it, so you tend to be urinating. You'll be urinating. It now will cause dehydration. Water is important. Pack water for children to go to school. Liberal water is very good. So have we dealt with meals now?
Yes. So we need to teach our children to take water. Not all this plenty juice that we're giving them. Okay, they've told us to wrap up here. Ruth, thank you very much, but you have to come again, because we are just starting.
We're just starting.
We are just starting. Ruth, you need to come again. Thank you so much. She's told us so much. Even I have learned so much from her. And viewers, I hope you've taken cognizance of everything she has said. Even if you don't remember everything, please go back to our Facebook page and replay and listen again to all the things she has said. Send the link to your friends so that they will hear all that has been said. I think I'm going to send it to our Women's Fellowship so that people can listen and hear. So, Dr. Ada, thank you so much.
Thank you very much. I enjoyed the discussion.
Thank you very much. Last words for today before we go. Last words.
Your children, whatever you do now, you're shooting them into the future. Get it right.
Fathers, please assist the women.
I hope we have heard. Ruth gave us a powerful sermon today. So if you didn't meet it, go back and listen. And please put your comments on our Facebook page and ask your questions. If you have questions, we'll try to get back to them later. Thank you, viewers, for staying with us to the very end. And we look forward to seeing you again next time, same place, same time. Please, it's not just enough to hear, but to practice all the things that we have been told, so that we can have these children, as Ruth said, that will be able to shoot far, that will do even much into the future, that will do even much better than us. So stay blessed. Let's continue to do what is right and honoring to the Lord. God bless you till we come your way next time. From all of us here,
bye-bye.
Bye.